Today, we're rolling out our Badger Bounce Back testing plan that will help us expand our reach through 4 strategic areas. First, we will work to manage community outbreaks. We've seen these kind of outbreaks spike in communities in Brown County and Sauk County. Our plan will work to respond to every employer, corrections, and congregate care outbreak. Wisconsin's DHS and the Wisconsin National Guard are coordinating with local health partners to conduct testing of all workers and families associated with employer outbreaks happening throughout the state of Wisconsin. Testing has also been occurring at county and state correctional facilities throughout the state. And the Bureau of Communicable Diseases within the DHS has established rapid response teams to address employer and congregate care outbreaks. Our second goal is to test every nursing home resident and staff member in long-term care facilities. The state will provide free testing and diagnostics to all 373 nursing homes to test all nursing home residents and staff. To get this done, we anticipate testing over 10,000 residents and staff per week during the month of May. Teams of public and private sector partners will begin calling nursing home facilities today to coordinate supplies, logistics, and test results. Our third step, and one that is already underway from Kenosha to Outagamie County to Turtle Lake, is to establish community testing programs for symptomatic individuals in target communities. By increasing the number of free drive-through community test sites, we can work to ensure every Wisconsin resident or worker who needs a test receives a test. The state is now mobilizing an additional 15 National Guard units to assist local public health partners in setting up testing sites and responding to outbreaks. This brings the total number of Guard units working on testing to 25. But capacity is not the same as utilization, so we have some work to do to ensure everyone who needs a test is getting one and to understand the full scope of this disease around Wisconsin. The state has been working hard to support local health departments throughout this crisis, and we continue to add additional community testing events. I urge anyone who is experiencing any symptoms of COVID-19, even mild symptoms, to go get tested at one of these events and spread the word about these testing sites with your friends, families, and neighbors. You don't need a referral from a doctor to come out and get tested at one of these sites. People living and working in Wisconsin who are experiencing COVID-19 related symptoms will be able to receive their tests free of charge. Results will be provided to the person from their local public health department within 48 hours. And finally, our fourth step is to ensure that everyone who is experiencing COVID-19 related symptoms receives a test by ensuring that test supplies are available to all Wisconsin healthcare systems. The supplies and laboratory services are available for testing symptomatic and asymptomatic individuals based on clinical guidelines established by the organization requesting the materials. This includes testing supplies for patients being discharged from a hospital setting to a congregate care setting. Test supplies and diagnostics are available to Wisconsin healthcare organizations at covidnineteensupplies.wi.gov/testing. Right now, the state is in pretty good shape on testing supplies, and we appreciate the support we've received from the federal government to date. But Wisconsin still needs help from the president to get additional testing supplies like swabs and reagent so that we can ensure anybody who needs a test can get one.